Thank you for logging into the Self-Help series. My name is Christy Knight. I'm a social worker with the Geriatrics Research, Education, and Clinical Program with the Durham VA Healthcare System. This is part of a series of supplemental self-guided presentations that you can view at your leisure to get more information about topics of interest to you. In this presentation, we are going to talk about steps you can take towards helping you, as a caregiver, more effectively manage your veteran loved one's dementia symptoms and behaviors. As a caregiver for a person with dementia, there are additional challenges you are faced with day to day. Through today's presentation, I hope we can provide you with some tools and resources to help with challenges that come with caring for a loved one with dementia. We will talk about the diagnosis of dementia, learn about some common behaviors associated with dementia. We'll explore the ABC model of managing dementia symptoms and behaviors, and learn about some interventions that may help manage symptoms and behaviors. What is dementia? Dementia is a brain disorder, most common in older adults. It destroys vital brain cells, causes memory loss, confusion, impaired judgment, personality changes, disorientation, and the ability to communicate. In this picture, you can see a picture of a healthy brain compared to a brain with advanced Alzheimer's disease. Although Alzheimer's is only one example of a disease that can cause dementia symptoms, you can see how dementia can impact all areas of the brain, affecting one's judgment, emotional control, attention span, memory, planning, reasoning, perception, language ability, and movement. Here are some of the common behaviors that your veteran or loved one may be exhibiting if he or she suffers from dementia. They may have anxiety or restlessness, refusal to bathe, change clothes, or even take their medications. They may be paranoid or suspicious. Perhaps they wander, which means walking away, get lost, or pace. They may shadow you or follow you around. There may be some depression or apathy, feeling down or blue, day or night confusion, rummaging or hoarding, sexually inappropriate behaviors, or hallucinations, which is hearing or seeing things that others don't hear or see. You may notice other behaviors as well, such as inappropriate toileting habits, such as use of containers rather than the toilet or toileting in public. So let's look at the ABC model. A stands for antecedent, or what may trigger a behavior. B is behavior, the behavior itself, the specific behavior. Or C is the consequence, what happens after the behavior. So let's look at A, the antecedent, or the cause or trigger. First step would be to think about what was happening right before the behavior began. Was it during a transition? For example, it's time to leave for an appointment. Is it occurring as the sun is going down? Was there a lot of stimulation going on at the time? For example, a lot of people or a room with noise or bright lights. Was there something that happened or something you can associate with the start of the behavior? These are some examples of possible triggers for the veteran's behavior. Is it a physical problem? Could it be related to pain, thirst, hunger, feeling cold, hot, warm, tired, or sleepy? There may be psychological issues, feeling bored, scared, lost, embarrassed, disoriented, frustrated, isolated, or invasion of privacy. Is it the environment? Is it overstimulating? Is it too noisy, crowded? Or are you in an unknown place? Also, medications may cause adverse reactions. Remember, look at when, where, with whom, or any patterns. Now let's look at B. Let's identify the behaviors. So refusal. unwillingness to take a shower, remove their coat, or put on pajamas. Repeating behaviors such as, "I want to go home," and repeating that over and over. Or, "Where are you taking me?" There may be hallucinations, as mentioned, seeing things that others don't see, or hearing things that others don't hear. Now let's identify the consequence. Identifying a consequence involves looking at what happens right after the behavior. Identify the consequences of that behavior. For example, the behavior is that the veteran gets up at night, and the consequence is that the caregiver is unable to sleep. Another example is the veteran refuses to shower. The caregiver gets irritated and starts an argument. Or the veteran is pacing or wandering, and the consequence is that the veteran may get lost. Once the behavior and consequences have been identified, we develop a plan to modify the behavior and prevent that consequence. For example, you might identify the behavior as your veteran is refusing to shower every day. What is the consequence? Do you get upset? Is it more an expectation problem rather than a behavioral problem? Is it that the expectation is that your veteran shower every day? Maybe you can set a more realistic expectation. What about getting a shower every other day or 3 times a week? Unless the veteran is soiled, perhaps this adjustment would work. As a caregiver, you may need to be realistic when dealing with dementia-related behaviors and pick your battles. There will be plenty of them, and you need to preserve your strength and patience. There are a number of different strategies that can help you come up with a plan or consequence to your veteran's behavior. Let's look at communication. Communication can be many things. It can be your eye contact, your gestures, body posture, language, your facial expressions, or certain objects you may use. It is certainly challenging when your veteran is exhibiting challenging behaviors for you to remain calm and pleasant and reassuring, but try, in advance of a situation, to prepare yourself to use communication to help diffuse a situation. Remain pleasant, calm, and reassuring. They will probably act angry, sad, or upset if they see you are angry, sad, or upset. This is called mirroring. Dementia patients will still understand some or even much of what is being said by reading your non-verbal cues. So let's look at positive communication. By having a plan, you are more likely to be able to respond to a challenging situation with positive communication. Your tone should be soothing and sound pleasant to the ears, especially important if your partner is upset or angry. Keep the pitch somewhere in the middle. High-pitched voices can be jarring to the nerves. A low pitch can seem threatening. Keep the speed of your speech average. If your speech is too slow, they may lose the thread of what you are saying. If it is too fast, they might not understand. Inflection. Inflection helps them understand the meaning of what you are saying. Be very aware of it. Make sure that they understand what you are trying to convey. Try to keep your face relaxed and smiling. Your eyes need to look that way too. It is hard to keep your features calm and pleasant if you do not feel that way, but your partner will read your face and may become upset if you do not look pleasant, calm, and reassuring. Be aware of your body language, such as posture, hand and arm movements. Lean forward, open your hands and arms to convey a gentle, understanding message. Leaning back with folded arms, arms tight against the body, and clenched fists all can convey a negative message. Remember, it can be very frightening and scaring for your loved one when they are experiencing symptoms. They may be feeling in danger. They may feel vulnerable. Let's offer reassurance. They need to hear that they are safe and loved. Tell them you love or care for them. Tell them they are safe. Apologize. I'm sorry. Tell them you will take care of it. Offer a hug or gentle touch, or simply smile. Another strategy to diffuse challenging behaviors can involve disrupting their current mood or train of thought with something more pleasant or functional. Redirection or distraction can be a powerful tool in getting your veteran back on track. Change the topic. Engage in an activity. The busier, the better. Offer something that motivates them. Tea, cookie, or ice cream. Everyone loves ice cream. Ask for his or her help. Offer something to hold in their hands and engage or fidget with. Change of a face. Call a family member or friend to take your place and give you a break. Sometimes an effective strategy in diffusing a challenging situation is to encourage reminiscence. You may find a topic or memory that your veteran or loved one finds particularly comforting or positive to talk about. For example, in a situation where your veteran is insistent that they want to go home, ask them some gentle questions about it. Questions such as, how was your home? What color was it? Who lived there? Did you have any pets, animals, etc.? Even if your veteran loved one is confused, he or she still has a need to express themselves and be heard. Allow them some time to talk about the past. You can probe when they talk about the past or past memories, especially if it seems to help calm them down. A great phrase to use is, tell me more about that. This is a great tool or phrase to use to get your veteran to talk more about their positive memories. And remembering happy or positive memories can help improve their mood overall. Again, when your veteran or loved one is confused, he or she still has very real feelings and a need to express themselves and be heard. Allow them some time to talk about how they are feeling. Acknowledge how they are feeling and reassure them that you understand. Try gently stating, it looks like something is bothering you, or you are right. That sounds very upsetting. It sounds like you're feeling scared. Please tell me about it. So let's evaluate the plan, the antecedent, the behavior, and consequence. ABC. When the situation has settled down and you have a quiet moment to reflect, evaluate the plan. What challenging behavior happened? First, you might ask yourself, is it really a problem? For example, if the veteran does not want to get dressed today and you're not planning on going out, is it a battle worth having? Then ask yourself, what happened? Where did it happen? With whom does it happen? When does it happen? Next, ask yourself, what did I do in response to the behavior? What strategies did I use? What helped? What didn't help? Often, the best of plans involves more than one strategy. It is also important to remember that sometimes what worked in one situation may not work in another. At the same time, what worked today may not work tomorrow. Try to be flexible and not get too discouraged. The more strategies you familiarize yourself with, the more tools you practice. The more situations you are faced with, the more comfortable you will be in managing these challenging behaviors and situations. Here are some other interventions you may want to consider. There are many possible tools for interventions or redirecting during a difficult situation. Perhaps music is particularly soothing or is a good distraction. Maybe a specific scent evokes a positive memory. Does the veteran have pets? Pets can be a great distraction. Sometimes a recreational activity like a movie, a card game, maybe a walk may help. Humor can be a great tool as well. Just be sure that the humor is kind and not likely to be misunderstood. Challenging behaviors can at times push your limits as a caregiver. Having a strategy, tools in your toolbox, can increase the likelihood of effectively managing challenging behaviors without becoming exhausted. When developing your plan and when using your strategies, it is important to keep a few things in mind. I want to take this time to thank you for being a caregiver. Be kind to yourself. Take good care of yourself. Love yourself. If you can, take time out for yourself every day, even if it is only for 15 minutes. Thank you for taking the time to view this presentation. If you have any questions or are in need of some resources, please reach out to your local Caregiver Support Coordinator or call the VA National Caregiver Support Line at 1-855-260-3274.